Without wasting time, let us see some questions which were not answered last YouTube live because the time was over. So there were few questions. I will just combine those questions and just give you the answer. There was a question where there was something about related to skin. Somebody had asked me about the scar tissue. What to do about the scar tissue? Now, actually speaking, scar tissue or a fibrosis or keloid normally. In my practice also I have a lot of cases where it is very difficult to treat a keloid, though I have few cases which have given good results, but in some cases it takes time. So it is not always do prescribe thiocinamide. It's a patent medicines for keloid. In cicatrices there are things which you should take care of. First of all, see at the cicatrices and see how are they looking. Are they bleeding easily? What is the color? It is dark in color, it is bluish in color, or it is brown in color, or it is very painful on touch. Now these are good afternoon, Dr. Ahuja. Now these are things which normally I see in my practice, or it is a keloid. For example, a scar mark, cicatrices, the patient says I had this for years together, but suddenly after the viral, this cicatrices has been opened up and it is bleeding, sometimes discharging pus and a lot of other things. So there is a very interesting symptom called as cicatrices which break open, and the first remedy that everybody should know, and everybody knows it also, that is graphitis. Apart from graphitis, I have got good results with few remedies which I will just share with you. First is graphitis, second is Cilicia, then natrum mur, causticum, and a few other remedies. Sometimes the cicatrices are cracked. The lady comes to you and shows the scissor mark, and the cicatrices are cracked and they are painful sometimes. So whenever the cicatrices are cracked, think about kali carb. Sometimes cicatrices are very, very hard. Again, think about calcarea floor, fluoric acid, or you can think about kali bichrome also. And last is keloid. Whenever you have a case of keloid, make sure that you understand why the patient is suffering from keloid. In keloid, there are some medicines which are used very, very frequently in our practice. Of course, the first remedy that everybody knows is thiocinamide. Apart from thiocinamide, there was a case in my practice where the patient had done radiotherapy, and after that she had got a keloid. Welcome, Dr. Ahuja. Dr. Chavda says, thank you, sir. I am lot of relief from MAC-carb in last T3. It is very nice. Thank you for sharing your results, and do keep sharing your results. So I also get some boost that my YouTube live basically are not going, like, okay, one more YouTube live. They are having some meaningful results in your practice. Extreme weakness in diabetes though sugar is controlled. Okay. So first of all, when you think the patient is suffering from weakness. Now, there are certain causes of weakness. If you see the repertory or Mater Medicum, there are so many listed symptoms for weakness. Now, suppose if the diabetes is high, suppose if the diabetes is uncontrollable, or sometimes the patient is diabetic and suddenly he develops that he has weakness. If it is because of diabetes weakness, then you can take it as normal symptom, because in diabetes weakness is there. But in homeopathy, I have seen what is the presenting symptom with diabetes is very, very important. For example, the patient comes with symptoms of weakness with diabetes, or patient comes with symptoms with lot of boils with diabetes. The patient comes with symptoms of a lot of itching with diabetes. That becomes very important, doctor. So whenever the patient is suffering from diabetes, although it is under control, but still the patient is taking medicine, so we label it as diabetes weakness only. And the first remedy that normally comes to my mind is that arsenic album. Arsenic album is a very interesting remedy for weakness, either diabetes or anything, but malignant weakness, the first remedy. Second, you must think about is Argentum metallicum. Argentum metallicum also has a symptom that is weakness in diabetes. And third remedy also, that is again Very important, because whenever diabetes increases, it causes lactic acidosis, and the remedy for this would be lactic acid. So lactic acid, arsenic and argentum metallicum, three remedies for diabetes mellitus with weakness. Now there are some remedies which I have clinically found useful in my practice, not given in books, but I have seen a lot of cases. First is China Ars. China Ars has given me very good results when there is weakness with diabetes, not listed in the basic protocol of the remedy. Second remedy which I have found very useful when there is weakness, though the diabetes is under control, but still the patient is taking medicine, is Ars sulflavon. And the third remedy which I use if the symptom corresponds is Naxonica. So my dear friends, these are my clinical remedy which I have used in my practice, which are not listed in the Mathemedica or repeated, but this is my experience. So I want to share the experiences which I have got results, because there are in 30 years of practice I have seen a lot of symptoms which are not present, but still the remedy is working. So protocol के हिसाब से argentum metallicum, lactic acid and arsenic album, and I have seen in my practice China Ars, sulflavon and Naxonica. Okay, so let us go forward. Sir, should we give state remedy or constitutional medicine in autoimmune disorders? See, autoimmune disorder, it is basically a syphilitic miasm. So, anti-miasmatic remedy or the constitutional or the similimum, remember the word similimum. Similimum covers everything. So, if you give a similimum, it covers the constitutional part, the miasmatic part, everything. Autoimmune disorders, though difficult to cure, but mark my words, homeopathy has a very important role and a very easy role to heal the patient. For example, in case of rheumatic arthritis, rheumatoid arthritis or arthritis, patients comes to us from a rheumatologist. He has taken a lot of medicines, especially painkillers and disease modifying agents, everything he has done, but still the patient says, whenever I take the medicine, the pain is better. In that case, homeopathy would offer a very important role in the treatment. Next disease, psoriasis. It's a very important disease because it is basically related to mind, and in modern science the only treatment is steroids. But in homeopathy we have a very good results in my practice. You can ask my fellow doctors who attend with me, we have fantastic results. That's why I say similimum. Similimum is the only truth. You hit that truth and everything falls into its place. That is my experience in treating that. So what I was telling you, something about what I was telling in relation to, I just forgot, because I was answering some questions, so I just missed out. I think I was discussing something about skin and something in relation to cicatrices. And the last disease which I was basically talking about was, there's a question on my WhatsApp. I'll just take that question first. Okay, so I'll just take the question first, which is on my laptop. So I was just completing keloid. Now see, keloid, again it is a cicatrices, but the first remedy that everybody should know is thiocyanamino. I was discussing, a lady came to me with, she had cancer and she had taken a lot of radiotherapy and she had developed keloid. And from the operative spot, which was there years back. In that lady, I prescribed thiocyanamino, I prescribed fluoric acid, nothing worked. But I prescribed the lady radium brome, my dear friends, radium brome. And radium brome I started with 30 potency, then 200 potency, and then LM potency, and that has given fantastic results. Whole of the keloid is much better. So in keloid, thiocyanaminium, fluoric acid, radium brome, carcinosin, these are the remedies which I have been using in my practice with good results. If there is any question, you can definitely ask questions. Otherwise, I keep telling what I basically want to tell you. So yeah, there was one case in my practice where the patient came to me when he was, I think, 56, and he had done appendectomy when his age was, I think, 19. After 30 to 40 years, the patient says this was there, but now it has become elevated. It is painful. very old cicatrice has become painful. And of course I used 5 or 6 remedies, but there was no result with that remedy. Even I was surprised that why the remedy is not working. So I just opened the repertory and just saw cicatrices painful which are old, and there was one remedy in that was Bothrops. Bothrops atrox, ATROX. It's a snake, and I prescribed the patient Bothrops. I only had the 30 potency, so I prescribed the Bothrops twice a week, and I was so happy that after 3 months the patient's whole scar symptoms vanished. In fact, the cicatrices also was much better. So sometimes what happens is that the common remedy does not work, and then you have to tax your mind, read Mater Medica, read repertory, and find out some remedy why it is not working. So my advice to all the young doctors, though you have a good practice, you have got good results, but make sure that you read not every day, at least once in 2 days, Mater Medica or repertory, whatever you like. Just keep on seeing pages, looking at pages, so that something which you have not read or something which you have not understood also keeps coming in your mind, and you can get good results. But you have to be a good learner. That is very important. But because nobody can master homeopathy, it is such a science. So all cicatrices, do think about Bothrops atrox, and this was the remedy which I give. There was one a girl, she was I think 14 years of age, and she had been operated for cyst, and that had become very painful, and it was so painful that whenever I used to touch that cicatrices, it was very painful on touch also. And the whole constitution I had prescribed the constitution medicine. So I had prescribed the patient Pulsatilla because she was classical Pulsatilla, and she was much better with Pulsatilla. She's improving very well. So I just went into the Mater Medica of Pulsatilla and just was turning pages, and I found that cicatrices which are painful on touch, the first remedy is Pulsatilla, my dear friend. First remedy is Pulsatilla. So this is how, when your remedy is right, everything basically starts matching with the patient, and that's how you should practice. And that's why I tell everybody to read every day Homeopathy Mater Medica. Don't ask me how your Mater Medica is good, how you repeat. Everything basically is upon studies. Okay, so let us go forward. If there are no questions, I can still keep. Any questions? It is 1st November. The questions has had to be very fast, because it's the first week. It's the first, day of the month. It's a Saturday. Tomorrow is Sunday, so we are happy that we are going to relax. I will not relax. I have a clinic at Bombay also. So let us go forward. So this was something about cicatrices. Now I'll just basically come to a symptom which was the question which was asked to me by a lot of doctors, that whenever a person comes to us and says that whenever he gets up in the morning, the face is bloated. The face is bloated. Now, of course, the first disease you have to rule out is hypothyroidism. In hypothyroidism, the basic symptom is bloating of the face. And the patient comes and tells you, Doctor Sahab, I have done thyroid report 4 to 5 times. Whenever I go to the doctor tells me, do a thyroid, and the thyroid is normal. And then you have to understand why there is bloating. I had a very interesting case, of migraine. And the patient, of course, the whole case was taken, everything was done. But the patient was only partly better with the medicines. And after some time, the patient comes and tells me that, the doctor, whenever, I have migraine headaches and my face is bloated. And I was so surprised when I opened the Mater Medica, opened the repertory. First, I prescribed the patient, and the patient had a history that she had to take care of the parents, of the mother-in-law, of her parents, of husband, of the child, and a lot of things. So she always felt that I am stuck up. I cannot move out because I have to do something about him, something about her, everybody. So I feel as if somebody is wiring deep and deep. So I just opened the repertory and saw bloating of the face during headache, and the remedy is Cactus grandiflorus. If you see the mind symptoms of cactus, there's rubric delusion as if tightened by wires. Wires means emotions. tightened by wires, and the remedy, one of the remedy is Cactus grandiflorous and the second is Simesifuga. So I prescribed the patient Cactus grandiflorous 1 ml single dose once in 20 days, and in 3 months the patient was much better. Okay, so let us have some question. Good afternoon, Dr. Vishaka. Sir, any remedy for melasma? If you ask me also, melasma, very difficult to cure, but we have a rubric in the face, discoloration grayish, discoloration blackish, discoloration earthy, discoloration ash colored. So depending on that coloration, you can prescribe the medicines. Okay. Sir, in post TB fibrosis without symptom, yeah, in fact I had told this some few YouTube back that I have not only treated but cured a case of fibrosis of lungs, which was 80% the lung was fibrosed, and I prescribed the remedy. In 3 months the fibrosis was not better, it was cured. So this is the, we can't say magic, this is the clinical application of homeopathy that you should understand. Don't think that this is curable or not. Everything which is curable in homeopathy. Your case taking has to be good, your interpretation of the symptoms has to be good, understanding of the patient's travel of disease has to be good, and then the potency. Okay, so these are the very, very important things to understand. We can definitely cure that. Sir, drug picture difference between Rustox and Rus glabra versus Rus veneta, is there any? Basically Rus glab, these are very, very, Rustox, see, everybody knows what is Rustox. So I don't need to say something about Rustox. Now I'll just tell you something about Rus glabra, which I have used in my practice and I have got good results, and Rus veneta. Now if you open your Mater Medica, in Mater Medica, Rus glabra. Now Rus glabra has, very, very, little role in some of the diseases which I have taken care of. In Rus glabra, there is one symptom which is very, very important. I remember the symptom because the patient came and told me dreams of flying through air. The other remedy you must think about is Sticta, and then Rus glabra. And one thing which is very, very important in Rus glabra, which I have used in my practice, is stomatitis. Sometimes, you give Muxol, you give Borax, you give Fluoric acid, you give lot of remedies, nothing works. In that case, you must think about Rus glabra. It is written that it is antidotal to the action of mercury and has been employed in the treatment of secondary syphilis. So this is Rus glabra. Now Rus veneta, basically whenever I have used veneta, I have used hardly 2 or 3 times in my practice, and I have used Rus veneta when Rustox has failed in severe case of itching, urticaria, or itching of the skin. That is the only case which I have used Rus veneta. And if you see in Rus veneta, there is one symptom very important: vesicular inflammation of the ear, and the nose is red and shiny, and the face is swollen. This is the symptom which I have took a prescription, and tongue red at the tip. It is like tongue red at the tip, like Rustox, and fissured in the middle. This is the only time when I have used Rus veneta. Rest, I don't know. I hope whenever you feel that your question is answered, please tell me yes, so that I can go forward. Otherwise, I have to answer. I'll keep answering till you are not satisfied. No, sir. Kindly also tell some medicines for severe immense pain in frozen shoulder when normal medicines are not working. Yeah. Again, frozen shoulder, in fact, most of the time, if you see, it is because of diabetes mellitus. In fact, chronic diabetes mellitus. It is also called as encapsulitis. Now, whenever the patient comes to you with frozen shoulder, first of all, make sure whether it is right side, it is left side, or it is bilateral. There are few remedies which I have used. Right side, the remedy which is very useful is, of course, Sanguinura canadensis. For left side, you can think about Spigelia or Kalmia latifolia. Now, there are some medicines which I have used sometimes in my practice in LM potency in repetition when these have failed. You can write down these remedies. First, I think about Calcarea floor, because it is tendinitis. The tendons and the muscles are basically adhesion is there. So Calcarea floor works wonderfully in LM potency. I start with LM1 and repeat twice a day, and then LM2, LM3. but make sure that in the background, if the patient is suffering from diabetes, it is basically under within normal limits, and the patient is taking medicines regularly, because otherwise the results are wavy. Sometimes the patient can also be better by naphylam and salicylic acid 30. Other remedies that you can use about is ruta and Belispar. Sir, please tell about left side. I've told you about different Veratrum Al versus Veratrum Viridi. Now again, sorry. Again, Veratrum Al, most of you know about Veratrum Al. Like for example, Veratrum Al, first the whole constitution of Veratrum Al basically revolves around what, the social position. The patient basically is concerned about the social position, that is Veratrum Al. And the symptoms of diarrhea and the coldness and the perspiration is there in Veratrum Al. Let's move our, thinking about Veratrum Viridi. Now, Veratrum Viridi, most of the time we think about only one or two complaints. First of all, Veratrum Viridi is a very, very important medicine where it is related to blood pressure. When the systolic and diastolic blood pressure both are high, Veratrum Viridi works very well because of the first action of Veratrum Viridi is congestion. Congestion in the base of the brain, in the lungs, with nausea and vomiting. Imagine a condition where you have a lot of congestion in the lungs and the brain and you start vomiting. What happens after that? After vomiting, there is great prostration. The face is bloated, it is livid. That is Veratrum, Veratrum Viridi. And it is a very important remedy. It is written in the Mater Medica that zigzag temperature. You can use the word oscillating temperature. So this is Veratrum Viridi. And one thing also is very, very important, that Veratrum Viridi has the head is hot and the eyes are bloodshot. These are the only conditions which I have used Veratrum Viridi with very, very good results. Of course, there are 2 or 3 symptoms which you must think about Veratrum Viridi, is that pulse are very slow, irregular and intermittent. And one thing also important is that in Veratrum Viridi, because of congestion, the patient suffers from a lot of headache, especially at the base of the brain. This is Veratrum Viridi for me. Okay. And Veratrum Alb, I think everybody knows Veratrum Alb, very easy. It's not easy basically, but it has been used, so that's why we can't describe it in detail. It is basically Veratrum Viridi. If you see Veratrum Viridi, it's a remedy where Veratrum Alb, social position concerned about, and the patient will do what he wants. That's why there's a beautiful rubric called as blindness pretended, deafness pretended. He would not, whenever he wants to do something, he will do what he wants, he will not hear about you. It is not actually deafness, but deafness pretended and blindness pretended. That is the importance of Veratrum Viridi. This is something called as some implied Mater Medica about Veratrum Alb. And of course, in Veratrum Alb, if you open a remedy, open the book, it is written first line, maybe in most of the Mater Medicas, a perfect picture of collapse, extreme coldness, blueness and weakness. This is Veratrum Alb. And of course, the perspiration is cold, especially on the forehead, with nearly all complaints. This is Veratrum Alb. Okay, so yeah, everybody is understanding it, so I'm very happy with that. So let us have some questions, more questions, or Veratrum Alb, Veratrum Viridi will keep coming to my mind, and I'll keep remembering some symptoms of the remedy and start telling you the symptoms. So basically in my OPD there are doctors who are with me, so I keep teaching them Mater Medica. Now we have just started Alan's keynote teaching, so it's very fresh in my mind, so I keep reading Alan's keynote every time. Hey, Dr. Kamlesh, thank you so much. So let us go forward. There are some questions which are scrolled up, so if you can write it again, I'll be able to. This question of TB with fibrosis, I hope everybody understood fibrosis of lungs. Of course, see, we cannot have all cases of fibrosis cured with homeopathy. That's the only problem. Everybody thinks that if you cure one, you must cure everything. In homeopathy, everything depends upon your case taking, your analysis and evaluation of the symptom. So if you cure 10 cases and one case if you don't cure, people say, oh, homeopathy does not work. So everybody has failure. I have also failure, but I'm just telling you that it is curable. You can definitely try. Yeah, like camphor, Dr. Kamlesh. So if you see camphor, we just one of my juniors, assistant doctors, we have just completed camphor. If you see camphor, of course, camphor has the coldness, the cold clammy face, blue lips, and complete picture of prostration. But for me, if you ask me, camphor is the patient is physically and mentally weak with irritability, and the patient is excessively sensitive to cold air. The patient cannot bear the cold air. It is very similar to Hipparsulf, Soranum, and one remedy is there. Such an importance is of camphor. But we always think one thing: the surface of the body is cold to touch, yet the patient does not want to be covered and throws off all the cover. It is there, but this symptom of extremely sensitiveness of cold air is there, and the entire body is painfully sensitive to it. You touch a patient, I had gone to I had gone for a visit, and the patient says, and the house person told me that he sees the person is very weak and he's lying down, nothing is there, everything is painful, and I touched the body, and all covered. Just by these two symptoms, I prescribed camphor. Believe me, I prescribed camphor 200, one dose, 4 pills in half cup of water. I told the patient to give in every 10 minutes 4 doses, and I was sitting outside. After half an hour, the patient sat up and he asked for food. That is the importance of camphor, my dear friends. I hope you understood, everyone. Hello. Camphor? Yes? Yes, everyone? Camphor? So this is so understanding the Mater Medica and then application of Mater Medica. You use any Mater Medica. Every Mater Medica has got fantastic symptom. The application is very, very important, my dear friend. If you can apply the symptoms on your, when you visit to a patient and the patient is lying on the bed, lot of symptoms come to our mind. What symptom to take for prescription, and how to interpret that patient's language of the body, what the associates are telling about him. That is the entry point of the cases. Thank you. I have only 8% fibrosis in entry. Okay, there's no problem. You can go to a good homeopath. I think if you can maintain this. See, nowadays, when there is so much pollution, and in post-COVID, 8% fibrosis would not have any effect on your lung tissue. So take a precautionary measure, wear some mask, do some lung exercise, make sure that you use a good environment everywhere, at home, at the office. Try to be pollution or dust free. Don't smoke. Don't go in areas where there's people are smoking. Don't have passive smoking. So if you can take care of this also, I think it will be quite safe. Okay, so nothing to worry. ED in diabetes. I'll just take this question because this question has been repeated second time. Travel, fear, phobia, stress, anxiety, medicines, please. Now see, there is lot of remedies about this, that the patient, whenever the patient has to go, he has fear that I have to go. See, this is basically sometimes a normal symptom unless the patient becomes very panicky. Panicky means there is hyperventilation, lot of palpitation, lot of frustration, lot of palpitation, lot of perspiration. The patient cannot get up. The patient becomes absolutely out of control. Then you can think of some medicines. But this is a state where you have to give the patient medicines. If you know the patient has traveling sickness, you can start the treatment before that. Just before traveling, you give some medicine. It will be difficult for the patient to understand, get symptoms. So this is a state where the patient becomes out of control and panicky. Then you have some remedies, of course. And see, in homeopathy, if you just open one rubric, anxiety, anticipation, also you can get the remedy. So the first remedy you should think about is, of course, Aconite napellus. Second is arsenic album. Then you have cyclamen. Then you have calcarea carb. Then you have there are a lot of remedies. So like for instance, the patient says that I cannot travel by train because everything is closed. Then you can think about Aconite, Argentum nitricum, and Pulsatile and Natrium. There are a lot of remedies. And the patient has fear of everything. He can imagine, okay, if I go in the car, then what will happen? Then tire will get punctured, and if there is no petrol, how will I go? Imaginary troubles, then Kali Carb, CPI remedies are there. The patient, when he goes inside the tunnel, he feels very frustrated. That's why he does not want to go because there is a tunnel there. So depending on that, you have to prescribe the remedy. Yeah, my HB1C is 5 point. It is normal and no, it is normal, so there's no need. Gentleman is there. Yeah. So it's already half an hour up. Thank you everybody for joining, and I hope you enjoyed it as much as I enjoy sharing my knowledge with you. Thank you. Until next Saturday. Goodbye.